Good evening. I am Dr. Sanjay Singla. I am running Omnia Hospital Patiala. The topic for today's discussion is how to take care of heart in patients who are suffering from diabetes. So at present, heart diseases they remain the leading cause of hospitalization and death in patients with diabetes. Heart disease occurs usually when blood circulation to the heart is slowed or stopped because of a blocked artery. There are multiple reasons to it. Diabetes is one of the biggest reasons behind this. Diabetes affects all the heart tissues, blood vessels very much. So we need to take care of diabetic patients as good as of a patient who has already suffered one heart attack. That means diabetics are equivalent of a patient who has already suffered one heart attack. Diabetics need to take care of few things that can increase their longevity of life and the life devoid of complications. So what is diabetes? In diabetes, glucose is not utilized properly by a patient. Either the insulin secretion from pancreas is less or the insulin is not working properly in peripheries so that there is high concentration of glucose in circulating blood. So diabetes prevention is very important as it can affect your whole body from your eyes to your feet and especially your heart. In fact, people with diabetes they are twice likely to die from a heart attack or from a stroke. So we know that diabetics over the age of 65, approximately 2/3 of these patients die from heart disease. The chance of heart disease in these patients does not only depend upon how you control the diabetes, how good the control of diabetes is, but also the duration of disease. So that means treatment is also important, but the proper treatment and prevention is also very important in diabetics. So how we have to take care of heart? See, we have to see the three ABCs of diabetes. We have to cover them. One is A1C, that is HbA1c, which gives us indication how good the control of your diabetes is for last 3 months. We have seen so many patients who come with the report of fasting sugar in their hand, which is controlled, but a normal person is in a fasting state only for 1 or 2 hours in the morning. Rest of the time he is in a random state. So we need to control random sugar also. So we need to have each and every patient's HbA1c covered so that we know how good the control of the patient is on the drugs. His or her HbA1c level should always be around 6.1 to 6.2. The better the control of sugar is, better HbA1c is, there are lesser chances of developing a coronary artery disease or heart disease in layman terms. Second is blood pressure. The blood pressure of every diabetic as a person, as a disease, it should be around 124/84 by whatever the means is. So we need to take an antihypertensive whenever the indication is, and especially in diabetics. Third is cholesterol. We need to control cholesterol of each and every diabetic patient, but their control levels should be very stringent as compared to a normal person. So that means if we are having diabetes at our hand, the patient's lipid profile should be normal but below normal also as per the lab people, because our criteria for diabetics are different as compared to the normal people. So there are two types of mainly cholesterol which affects our heart. One is LDL, which is very dangerous. It should be less than 100. Triglycerides, they should be also very less, and HDL should be high. Next thing is diet. We should ask a diabetic to have a proper diet. The diet should include fruits, raw vegetables, and some dry fruits also. Eat right, cut down on sugars, cut down on oils, and cut down on stress. We know that stress is part and parcel of each person's life nowadays. So we have to decrease stress maximally as possible. The third thing that comes in diabetics is smoking. Smoking as such is a very big cause of heart attack. We have seen so many patients who are around 25 years of age. They are laborers, very hardworking, lean and thin. They don't have any hypertension or diabetes, but they come with acute myocardial infarction, that means heart attack. The only problem in those patients is smoking. So when we combine diabetes with smoking, we are inviting a heart attack to ourselves. So we need to control smoking. We need to go for smoking cessation. We need to have a willpower that we should quit smoking. Diabetes is a disease given by God or whatever the means is. We need to control it, but smoking is in our hands. We need to shun the smoking so that the chances of heart attack in future are less. We need to maintain a proper weight of every diabetic patient. Obese diabetics, they are very much prone to heart disease because obesity itself is a factor for increasing heart disease. So the patients of diabetes, they need to have their weight in control. The weight in control can be done by proper exercise, proper walking and proper diet. Every diabetic should at least walk for at least 30 minutes a day for at least 5 times a week. This is the minimum proper exercise for a diabetic patient. The exercise should be 30 minutes per day for 5 days a week at a speed of around 3 km per hour. Second thing now comes is the treatment of diabetes. We have seen a lot number of patients who are taking age-old treatment of diabetes like sulfonylureas, gliclazide and glimepiride. Right now these drugs have been shifted to the 4th position in the treatment of diabetes. As per the latest guidelines, we have lot number of drugs which give us a better control of heart disease in the patients like SGLT2 inhibitors, GLP-1 receptor analogues, insulins, DPP-4 inhibitors. These drugs should be used earlier in these patients before sulfonylureas. SGLT2 inhibitors, they are the cornerstone of treatment of diabetes nowadays. If the patient is having some of heart disease or the patient is predisposed to heart disease, we need to have SGLT2 inhibitors as the first choice of drug. But if there is some kidney involvement is there, GLP-1 receptor analogues are the first choice. Earlier, the GLP-1 receptor analogues, they used to come only for as an injectable form. Right now, from next month, God willing, we will be having a oral GLP-1 receptor analog in our hands, that is semaglutide. This is a boon for all the patients who are suffering from kidney disease with diabetes. So we should not take, every patient should not take a treatment from a chemist or from peer group or from like a relative who is taking the treatment. The treatment of diabetes has to be individualized for the patient. We need to see that patient is having which parameters, and the patient, a particular patient needs a particular drug or a particular subset of drugs. The HbA1c of that patient should be controlled. It should be around 6.1 to 6.2 as I told earlier. He should be having good drugs. He should be having good exercise schedule, good lifestyle, because we say that diabetes is a disease of lifestyle. Now coming to the investigation part. We need to ask every diabetic to go for a echocardiogram, that means echocardiography, every 1 year. So that means every year every diabetic patient should go for an ECG and echocardiography, so that we come to know that the patient is not suffering from heart disease of diabetes. Because in diabetes we say that the patient does not suffer from any symptom when a heart disease occurs. The heart disease of a diabetic is symptomless, painless. We have seen that so many patients come to us for surgical fitness or some other type of fitness. We see that their echo and ECG when done, it has some problem. So each diabetic, whenever he is having some atypical symptom like gastritis symptoms of sore eructations, खट्टे डकार, जलन, पेट दी फ्लावट या कोई भी atypical symptom, he should consider going to a doctor as early as possible, get a ECG done, get a echo done. So every diabetic should be taken care of from echocardiography point of view, because there is a form of heart failure, that is diastolic heart failure. That heart failure mainly occurs in diabetics, that can be only be seen or diagnosed by echocardiography. So to be if the patient is to be treated as a whole, we have to see that patient is taking proper treatment, proper diet, proper nutrition, proper this weight management, and proper investigations. Thank you.